KHF engagement with the Kenya Health Human Resource Advisory Council. It's a very active council, and I think it may remain, I hope it remains very active. They've actively been reaching out to Kenya Healthcare Federation. Dr. Sitoniki and Dr. Gitao have been representing us in all the sessions. They're actually also trainers of, I think, the National Health, I think the National Workload Education Staffing needs something like that, but we are fully engaged on this. So what our ask was the integration of health workforce IMS, which encompasses both public, private, and also FBOs, NGOs, and other health services at national and county level, so we know who is where at any one time. And then with that respect, so there's a national workload indication staffing needs. I think it's currently, they've sent out a survey for that. And then there's a legal framework for HRH data sharing. We have this framework, and we have forwarded it to the KEPSA legal team to give us feedback. I know it's not moving very fast, but we will push to make sure we get at least the feedback to the to the KHH RSC as soon as possible. Then the National Health Workforce Account based on human resources for health data. So this exercise will be taking place after the legal framework is approved. Then the other thing was strengthening of HRH capacity, strengthen cadre recognition, schemes of service, scope of service for emerging and existing roles, and need to expand facilities that can host interns to increase HRH capacity. And then in terms of what we're proposing, we are saying private sector is ready to partner with MOH in curricular development and training and placement of HRH, and I know we are. Some of our institutions are already hosting interns. And then HRH management and retention in terms of HRH governance, strengthen cadre recognition, schemes of service and scope of service for emerging and existing roles. We had the multi-stakeholder partnership program that has just ended. It was focusing on the emergency medical technicians, community health workers and volunteers, and information, health records and information officers. But of course, you've also seen, there is now recognition of morticians and so on and so forth, just also to make sure that we know who is where and, what is their scope of practice. Then updates on HRH exchange in Europe for work placement and value proposition for Kenya, and HRH data sharing framework. So we asked the ministry for progress on the document and implementation plan to be clarified. And basically, we were informed that the challenge is always that you cannot stop training when you cannot absorb everyone. But yet there's a country in another country, there's a need elsewhere. So you might as well just continue training rather than just say you cannot train because you cannot employ. And you cannot employ because you cannot absorb maybe because of resources, we don't know. So that's something, because our question was, why are you sending our nurses to the UK? You have a framework agreement, and yet we need them here. So it's one of those things that we had an interesting discussion.